at the UN, so we seem to have problems with Zoom. So, as a UN partner, we'd really prefer some other platform. We've had about 4 or 5 bad experiences with Zoom.
Okay, well, we seem to all be here. I just would like to check in with Armin Wagner, who is chairing the third session. I see you there.
Yes, hello, how are you?
Armin, a hand to you for the third session, which is also 40 minutes long. I'm not sure, you may have some people using PowerPoints, but you'll negotiate and navigate. We've got an excellent team supporting. And I see a number of your speakers there. Closing remarks is going to be Rob. Can I say hello to Rob?
He might not be on yet. He was finishing another call at exactly 4 p.m. Kenya time in 2 minutes. So he's got the link and going to jump on as soon as he's done.
Okay. Is there any further updates on the logistics that you'd like to share with us, Carly or Steffi? Like exactly when we'll start? Something like that.
We'll get started in exactly we'll give it 2 minutes. We've got about 70 people on so far, and we've got 500 people registered. But I think we will get going. We've got a lot to cover. So let's give it 1 more minute and then we'll get going. And I think, Fiona, you've got a few practicalities on your list to share once we start formally.
I can ask a practical question in the minute that is left, please. It's Marusha here. In terms of timekeeping, I understand that the organizers are going to be muting the microphones if speakers go past the 5 minutes. Am I correct in that assumption, that you're making it so easy for the moderators? So we are not the the naughty ones?
Yeah, so we're doing a kind of keeping. So you've got me, I'll be messages to speakers to let them know when they've got 2 minutes left. And then Fiona also has authority if it goes too much over, and she can kind of interrupt. And if people are still talking, then we can forcefully mute them, but hopefully we won't have to do that.
I'm pretty sure we will all collaborate. Thanks very much. So I get it right as a moderator as well. Thanks very much.
Yes, welcome.
A quick one to shout out to Edwins, who has joined. Edwins, are you able to speak?
Yeah, can you hear me?
Yes, we can.
Can you hear me?
Yes.
Yes.
Perfect. Good. Just to test. Thank you.
I think, Fiona, whenever you're ready, we can get started.
Okay, then. Well, thank you very much. So are we live?
Yes, we are.
A very good afternoon, good morning and good evening to everyone joining this half-day symposia, virtual symposia, convened by an extensive group of collaborating institutions on the topic of the Global South experiences, challenges, opportunities for managing urban mobility during COVID-19. It's all about moving forward together. These are exceptional times, and it is an exceptional opportunity this afternoon to bring so many of you out there virtually around the world joining us for this session with an excellent cast of speakers and facilitators to guide us through and to share knowledge. This is the focus of the session, to share knowledges and experiences about what's happening in cities and what the response is. I'm delighted to moderate this session. My name is Dr. Fiona Bull, and I'm from the World Health Organization Unit on Physical Activity, where walking and cycling is a core area, and very much in the sphere of responding to COVID and promoting health and keeping people safe. I'm delighted to have been invited by the collaborating organizations to chair and moderate this session, and I'm going to be helped by many others who moderate the particular components of this three-part afternoon. I'd like to take 1 or 2 moments to outline some of the logistics. Welcome to over 500 people who are joining virtually to this session. The session is being recorded and will be available after. It's also being live streamed, so many more are joining. The interest was so extensive. So welcome to everyone, wherever you are, whatever platform you're joining from. We are muting all of you so we can control from the center the opportunities for questions and answers. Your questions are welcomed through the chat box, and we have colleagues monitoring this who will be feeding your questions through to the speakers at the end of each session. All questions will be recorded, and you will receive an answer to these in the report that will come out after this meeting. We will try to keep very strictly to time. Everyone is rather busy and virtual makes things a little difficult. My moderators will help speakers and I will help the moderator. I reserve the right to interrupt if need be, if time is pressing and we're moving a little slower than needed. We have an excellent session with the speakers, and so without further ado, I warmly welcome you and look forward to the afternoon with you with a rich discussion and sharing of knowledge and experiences and plans for partnerships and collaborations going forward. It is my very great pleasure to invite our first speaker to open the session, Andrea Chicas, who is Chief of the Urban Basic Services section at UN Habitat. A very warm welcome to you, Andre, and I hand the floor to you.
Thank you very much, Fiona, and also thanks for the introduction and also for kickstarting this discussion. I'd also like to take this opportunity to really warmly welcome all the participants who've joined from all over the world on behalf of UN Habitat and also all the other partner organizations for this event. And also send the cordial greetings of our Executive Director, Maimuna Mohammed Sharif, who's very keenly following these webinars on the context of transport and COVID-19. And of course, just to remind us, I mean, we're really facing this grave pandemic, and we've seen that, you know, crowded public spaces, streets, and in public transport pose a particular risk of being infected due to the reduced social distancing between the individuals. So the world has really gone to a great extreme of a near global lockdown to prevent the further spread of COVID-19, which has really emptied city streets of people, cars, and buses, and the need for transport has dwindled as many people are actually staying at home. But on the other hand, public transport is an essential service. It's not only enable us to move of health workers, but also for people, particularly the poor, to reach their places of work and economic opportunities. In Africa and parts of Asia and Latin America, where public transport tends to be more informal, the risks might be even higher due to the overcrowding in minibuses. For instance, in Kenya, we've got the matatus or daladalas in Tanzania, and the generally poor upkeep of these public service vehicles. So national and local governments and as well as public transport operators in various countries are responding to the pandemic in different ways. Whilst a lot of the available literature and shared experience to date focus on the global north, this EGM, as you mentioned, Fiona, will really focus what's happening in the global south. Our focus today will be sharing the experiences from Africa, Latin America, and Asia, relating the responses in public transport, walking, and cycling during COVID-19. We hope that this session will inspire and assist policymakers in their thinking as they plan pandemic response interventions around mobility. We also hope that the discussions can bring out ideas around building response partnerships between international development partners, technical experts, governments, and the transport sector to synergize efforts and maximize impact on any future measures and interventions. We all know of the need to respond and take action is urgent. The COVID-19 response crisis is showing us the vulnerability of cities, mobility systems, and also people. It is evident that the impacts of the crisis are even more severe for people living in vulnerable situations, such as people with disabilities, the elderly, and those living in slums and squatter settlements. Previous pandemics have shaped how cities are planned 100 years ago, 400 years ago, and how people move in them. This time it will be no different. We must ensure that public transport retains the trust of people and does not become a casualty of COVID-19. Some cities have also seen a cycling surge during COVID-19. It'll be our role to ensure that we continue to provide adequate facilities for walking and cycling, modes that are affordable and through which social distancing can also be maintained. We have a window of opportunity to learn from this pandemic and to build back better by making our mobility systems more resilient and responsive to crisis. We should aim to get out of this stronger and ready to address climate change, air pollution, and also road fatalities. I'd like to conclude by thanking all the partners who've co-organized and contributed to this discussion, which is UNEP, WHO, DFID, SLOCAT, TUMI, ITDP, UITP, Urban Pathways, and the Solutions Projects, and of course the Open Institute. My special appreciation goes to all the speakers who found time really to join this session. And I really look forward to learning a lot from you during this session and to listen in. So thank you very much. And over to you, Fiona.
Thank you very much indeed, Andre, for setting the scene there, really focusing our attention both on the current situation, the global south, but also the perspective that this is a window of opportunity to build back better. It's my great pleasure to pass the floor to Holger Dachmann, Senior Advisor at DFID, to provide some further introductory remarks, setting the scene and context for this afternoon. Over to you, Holger.
Thank you very much, Fiona, and good afternoon and good morning and good evening, everybody. First of all, my thanks go to UN Habitat and all the partners to give me the opportunity also to speak also this afternoon. The reason is why I'm talking is at the beginning was work we are currently doing at the High Volume Transport Program funded also by DFID, and that's in fact looking into the question what kind of transport organization, international transport organization are doing also what in terms of a COVID-19 response and where are the gaps, in particular here focusing on the low-income countries. So it's a great pleasure also to present also some of the findings, but hopefully also to inspire the discussion and inspire also the action also we all need also to enable also more responses here. So as Andre also said, we have seen around the world different responses also by cities in terms of extending walking and cycling infrastructure to improve also public transport services, making them also cleaner and safer. But we also have seen also that the need also to locking down also some of the services, and Andre highlighted also the challenges, particularly so in the informal sector. So at the same time, we see more and more data coming in and looking also into the impactors of transport and also these measures. So transport is certainly also in the heart of COVID-19. But what are actually the international organizations doing? And here you see also on this slide, and don't worry, I will not get into any of those details. And apologies also that we not covered all the institutions already doing us a great work. So please also share with us also further information here. But that slide shows about also the activities of many players already also taking actions around events, saying also we are also going virtual, like we will hear later from Armin Wagner, from TUMI and others. We collect information like SLOCAT is doing, PIAC and many others to also bring also the information together. We see guidance on micromobility from ITDP and public transport on UITP and so on. We see finance action, but so far also the multilateral development banks mainly providing support also for health service, but I'm sure so this will also come soon. And we see policy advocacy and research and all that delivered in webinars and case studies and blogs. But what are now is the gaps, and I will like to share so just 3 slides on key messages also for this afternoon. First of all, from our perspective, there's a need for curation of low-income country information. We see a lot of information and good case studies and practice example on the global north, but there's not a good database in terms of what actually already happened in the global south. Second, there's a lot of generic guidance and policy notes, and we see for example, in the US, that there's a whole transport response center is set up, but we also have a slightly lack of dedicated guidance and policy notes, even though this is happening in some countries. So we need also to share also that on a better platform. And then also the issue of data. We always have issues also to collect sufficient data, particularly also in the developing countries. Nevertheless, also it's even more important now, and it's probably also a good opportunity also to say, well, this is a moment where we also have to come together and create also a common collection data platform also to share also the information. Secondly, also coming also to the common platform on impact information, as I mentioned, there are some national commissions set up, some response centers are also set up, but here probably also a little bit more coordinated approach might also help to provide also the cities and the government who also need also and still need also for further guidance and more information. But also it's a time for research. It's a time to identify also what are the impacts, what are the opportunities here. And organizations like the World Conference on Transport Research Society is currently also collecting information in terms of what currently is going on, but we need also to bring also that together. At the same time, as Andre said, it's a big chance also to look into and to test new interventions like pop-up bike lanes. And here this can also, the assessment can help us to guide our future actions. But let's also not forget, this is not just about transport, but also the nexus to energy, to health, to land use. And we have to look into also that. So to close also my brief presentation, it's really time for transformative transport action agenda for post-COVID world. So here, as we're doing also ourselves, can we also reduce also our own footprint in terms of creating also better information through also communication and events also online. At the same time, we have seen also how the world can respond far more rapid and radical. So can we also move that towards climate change and the SDG? And here, absolutely vital is also the alignment also with the investment and stimulus packages. We see the action we will see also from the international finance initiatives and organizations, as well as national government. Can we also make sure so that we have the right information for those governments also to take also the right action to get us much closer also to the commitment also on Paris as well as the SDGs. So with that also, I hope also this event today will also draw more attention also to the global south, inspire discussion, but also inspire particular action at the moment, but also at beyond also COVID. With that, I also like to thank the organizers, and you will see also more information on the high volume transport program on the link provided, as well as here's information covered. So thanks and stay safe. Thank you.
Thank you very much, Holger, for that excellent setting of the scene for us. I remind everyone participating, details of the speakers and the session are available in the materials circulated and online. But Holger has already laid out the agenda to inform each other, to inspire each other, to learn from what's happening, but also to translate that into what might be a better post-COVID future, where some of the changes here are actually opportunities. But the profound impact that COVID-19 is causing on all communities is now the focus, and we're going to look at the cities and hear what's happening from the city perspective. And it's my pleasure to hand over the moderation for the session one with the facilitator, Marussia Kardama, Secretary General of SLOCAT, who will facilitate a session hearing from cities. So I hand the floor to Marussia. Thank you.
Thank you very much, Dr. Bull. Thanks, Fiona, and thanks to everybody for joining us. It's really impressive to see this amount of people brace in different time zones, and I'm particularly grateful to the organizers for putting this very timely event together with this focus on the global south. Absolutely, you know, it's wonderful that for once we see this focus from the onset in this type of discussions. And also kudos to all of you to show us that we can overcome the lack of travel and the physical distance, and actually reduce our carbon footprints and travel a little less and still learn from each other and engage with each other. So thank you very much indeed. From SLOCAT, we certainly take pride in trying to bring people together, knowledge and partnerships together in order to power this movement of sustainable low carbon transport, and also bring the voice of the movement into the different intergovernmental spaces on climate and on sustainability. So we are certainly honored to collaborate in this event. And I think that, well, following Holger's great presentation, we can see that there's a series of areas in which we really need to be working heavily, whether it is the urgent response, whether it is aspects around freight as well to secure supplies, or whether it is the long-term reflection about how do we really transform our transport and mobility paradigms. At the end of the day, what we know is that local governments and regional governments are very much at the forefront, and we see them once again in the peak of this emergency, dealing in the front lines with citizens' needs and having to adapt very, very quickly to those needs. So what a better way to actually look into how local governments are facing this situation, and once more reacting directly by the hand of local elected representatives and technical officials dealing with this matter. Our organizers have actually put together an incredible panel that takes us through a bit of a tour around the globe. The panel consists of the Vice Mayor of Kigali, Mr. Ernst Napsibama. I would like to check if the Vice Mayor is with us right now in the meeting, because we are not very sure that is the case. So if that is the case, Mayor, it would be great if you could let us know that you are here. I understand that perhaps you will be joining us a bit later, so the moment you are with us, let us know, and I would certainly acknowledge you. Going from Kigali, we also have the pleasure of having with us Mr. Hari, who is the Additional General Manager for Urban Transport in the Kochi Metro Rail in India. So we go all the way to India. And if that was not enough, we're actually going to go all the way to Latin America as well. And by the hands of Ms. Maria Espinosa Jararisco, Director of the Authority of Urban Transport in Lima in Peru, we're going to learn from the experiences with a Latin American perspective. So with no further ado, and conscious of the limited time we've got and the fact that we want to learn here from each other, Mr. Hari, shall I pass on the floor to you to share with us a bit the measures that you are proposing to take and that you've been taking already, and the pilots that you've been actually also shaping with different Indian cities? The floor goes to you, please. I understand you have some slides, so please do share your screen, and we look forward to listening to you in the next 5 minutes. Thank you. Mr. Hari, I think we need you to unmute your microphone so we can actually hear you. I think you are still muted. Now we can hear you. That's perfect.
Okay, fine. So let us straight away go to the screen. Is this all right? Hello?
I am not seeing your slides. We are not seeing just yet. Perhaps the technology.
You'll need to share your screen, please. It's a button at the bottom of your, it's a great one. Yeah, there you go.
Perfect. There we go.
Yeah. So in India, we are still in the lockdown, which is the scenario 1. The scenario 1 is, it is completely in a restrictive mode till May 17th. Say for another about 10 to 11 days, we would be in the restrictive mode. That means the schools, the colleges, the whole, this is lockdown. And the scenario 2 would happen after May 17th. Say from 18th onwards, the scenario 2 will start, but not all the part of India. It could be in my state, the small province in the south of India, it's called Kerala. So Kerala, we would definitely go to scenario 2 because the number of the patients are less. We have hardly about 40 people hospitalized as of today. The death rate is extremely low. So the Kerala state is like to go for the scenario 2. So let us look at the scenario 2, where in the first week of June, the old schools are going to be opened. Then the shops will be opened, maybe from morning, say 10 to maybe a little late evening, maybe till 7 o'clock, 8 o'clock. It may not go beyond, say, 7 o'clock, 8 o'clock or not. Then the work commuters will also start functioning slowly and slowly. So our focus would be for the scenario 2 after May 17th. Once we stabilize, then we will have to go for the scaling up mode, which is the improved scenario, which is at stage 3. So if you go to the screen number 2, the scenario which is 2, the first one, the supervision, it is supposed to be done by the enforcement authorities, like the police department, the motor vehicles department, etc. The second column, which is for the social distancing, this needs to be done by the government authorities, including the enforcement agencies. The third column, which is for hygiene and safety, this would essentially the component of the operator, whether it's a bus operator, it's a taxi operator, or a metro like us, or whosoever may be. The remaining 4 columns: hygiene and safety, information dissemination, operations, and fare. These 4 components will essentially need to be addressed by the operators. The hygiene and safety is concerned, since March, people are accustomed, people know what is to be done, but there's some extent of enforcement to be done, and this needs to be facilitated. Say this sanitizer dispensing unit, or the soap or water, maybe this all could be made available in the bus stops, in the bus terminals, or in the metro stations, etc. The information dissemination is another important thing, because initially the number of commuters would be less. Most of the people would commute using their personalized transport. The good information system needs to be brought in. The another one is the demand-based transport. This is something which we are looking at. People should be able to tell at what time I wanted to leave my home, at what time I wanted to reach my destination. So we are trying to capture those demand from the commuters, and the operators should be able to do based on the demand. So a demand-based, this is being done. The operations, as far as operations is concerned, the government directive is to take only 50% of the capacity. That means if the bus having 35 seats, it can occupy only 17 seats. No standing on buses. So a bus which can carry 35 seats, it will carry only 17 people. This is applicable for metro too. Something like a metro system, we should be able to carry hardly 30 or 40% of the capacity. Then the last column is fare. Now we wanted to avoid the cash transaction. This is another, when you transact hot currencies, this would tend for this kind of thing. So another good opportunity is to promote the QR code ticketing, not even the smart cards. Again, someone will have to take it hand, someone will have to swipe. So this we wanted to avoid. So let us come back to the last slide, which is improvement mode. So we are going to learn a lot of lessons from the scenario 2. Once the shift is done, only then we should be able to do at improvement mode, which is the scaling up mode. So the screen, the scenario 3 is also in the screen. So we need to decide upon based on the learnings from the scenario 2. So that's it. My time is over.
Thank you very much, Mr. Harry, for so much sticking to the point and to the time, and at the same time providing such a wealth of information here. I think it's very telling how you've illustrated how some of the key arguments and the key foundational approaches we use in transport and mobility do stand. Avoid shift and improve still stands. Demand-based management stands, but perhaps how other notions that we've been using so much in order to actually help decarbonize transport and mobility are being right now I couldn't say questioned, but at least put on the spotlight. Like, for instance, load factors. We know that we've been talking very much about maximizing load capacities, whether it is for passengers and for freight. And right now, as we try to reconcile it with hygiene and social distancing measures, we find ourselves in a new perspective, isn't it? So thank you very much for that very illustrative perspective. Perhaps I'm going to give the floor directly, and we're going to go all the way to Lima, if that is okay. With our participants. I'm actually keeping an eye on whether the Vice Mayor for Kigali has joined us or not. I understand it's not the case. So it is in that context that I would like to pass on the floor to Ms. Maria Espinosa Jararisco. Let's go all the way to Lima and tell us, please, Maria, I understand that you've been actually using active mobility, whether it is walking and cycling, to precisely facilitate the social distancing measures that are so required right now. So please tell us a bit more about how Lima is living this experience.
Thank you, Maroksha. My name is Maria Jara.
Perfecto.
Maria Esperanza, if you want, Mary Hope. But
that's what we need right now, Mary Hope. So wonderful.
Yes.
Gracias, Maria.
Yes, thank you. Okay. The Urban Transport Authority for the cities of Lima and Callao was created 1.5 years ago in order to gather in only one institution all the performances of transport functions that were disaggregated in many organizations. Its goal is to give an efficient, sustainable, clean, accessible, safe, and modern system of transportation to all the people that lives in Lima, the capital of Peru, Lima, and its port, Callao. Since I assumed the position of president of the ATU, I knew the challenges were big and tough. Today, our mobility is chaotic. Lima and Callao have 11 million of persons, but only the 7% of the travels are made in quality transportation. I am absolutely sure this is a huge opportunity to make big changes to improve the quality life of our citizens. The coronavirus caught us in the middle of our efforts. However, the pandemic is also an opportunity, a very big opportunity to change things. And that is what are we doing. We are planning soon and executing a new strategy to reduce virus infection in public transport. This policy is the government response to a national health problem. This first measure we took was reducing public transportation in 50%. Only essential sector workers are allowed to travel in these days of quarantine, keeping recommended distances between them. Wearing masks is an obligation, but next week, other essential industries and services are going back in business, and we have to protect the health of the workers that are we going to return to their duties. So we devised the other strategy, a revolutionary one in Peru, where it's only 1% of population in Lima, in Callao, travels in bicycles. For that reason, our commitment is to increase the cycle lines of Lima and Callao from 142 kilometers we have today to 301 kilometers at least. We also need to improve and tie all the cycle line throughout the 43 districts that we have. Afterwards, this plan is going to be replicated in all the country, in all Peru, in all our cities. We are going to carry out our plan in 3 phases. In the first stage, we are going to connect our existing bike lines with 27 kilometers of new bikeways. We also have to improve the security and design points of the actual net. Our aim is that every bikeway is 3 meters wide. In order to achieve this goal, we are implementing temporal cycle lines using part of the tracks, as you see in the slide. The second phase will take us at 2,031 kilometers net. And finally, in the third phase, we will have the 301 bikeways net. I insist, at least. All this work will have to take us no more than 100 days. This is our goal. Of course, we are coordinating the implementation of this plan with the strongholds of Lima and Callao. They are most important stakeholders in this strategy. They are our local partners in this challenge. Of course, we have also the participation of the Transport and Communication Ministry representing the government as well. Another challenge we face is to put in the market the cheap and secure bicycle that is affordable for most of our people and convince them to use this way of transportation. 42% of the daily travels we made in Lima and Callao are short trips of an average of 7 kilometers. We are focusing our strategy in these short travels in order to take them out from the massive transportation to individual trips on bicycle. Along with the Ministry of Production, we are working out a model of bicycle that fits our people needs. We have already spoken to local businessmen about this plan, and they are eager to cooperate with us in the fabrication of this bicycle. We are thinking of average cost of $100. If we take into account that a person with low incomes in Lima and Callao invest in transportation an average of $360 per year, it will be an advantage to travel by bicycle. We also are coordinating with the Ministry of Economy and Finance to consider the possibility of a subsidy for the purchase of this bicycle. Last but not least, I want to mention the benefits this plan will bring to our country, to our environment. 58% of our air contamination comes from motorized transportation. If we can reduce this sort of transportation, we will be able to give our people a real healthy city. Thank you very much for attention.
Muchas gracias, María, por la riqueza nuevamente de la experiencia de las informaciones. It's so rich what you've shared. Thanks indeed very much. I think that I could particularly retain, perhaps the word opportunity is a difficult word to use right now, isn't it? When we know that a lot of people are suffering a lot from the current crisis. But indeed, there is a nerve that has been struck, and there is a lot of lessons that we can learn. And I think that you've illustrated so well how those lessons could be learned. Whether it is tactical urbanism or whether it is coping with the reality of less demand on public transport and what that means in actual terms to then support the backbone of mobility in a city, isn't it? So thanks very much, because with that you've also illustrated what Holger told us at the very beginning, the nexus between transport and land use, the nexus between transport and health. And I think that also very importantly, you showed us that some of these experiences can be scaled up. You were talking about how this experience in Lima can be scaled up to the whole of Peru. And last but not least, the element of governance. You talked about that one single authority that allows you to be faster and smoother, and how much we know that governance is in many times, the key ingredient to making these things work, with that multi-level coordination amongst different levels of government and that horizontal coordination across different departments. So thank you very much for the very interesting expose. So we go back now to Africa. We go to Kigali. I understand that the Vice Mayor is with us. He could finally join us. And it is my absolute honor to introduce Vice Mayor Ernst Nasabima, who is, I think, with us right now. Isn't it, Vice Mayor? Can I confirm with you that you are there? And can I please pass on the floor to you to explain to us what has been the local government response in the transport sector in Rwanda?
Okay, thank you for having me.
Very
Hi, everybody.
welcome.
Yeah, okay. Can you hear me, please?
We can hear you very well. Please go ahead, Vice Mayor.
Yeah, okay. Thank you very much. May I share with, of course, I have like slide of 5 slides, so maybe I should share with you.
So we could need you to share your screen. Perhaps, may I request the IT support to help us a bit out? Yeah?
Just in a few minutes, 1 minute, please.
Of course.
What?
So as we are waiting, let me just perhaps you're there. Excellent. Otherwise, I was going to perhaps share some reflections. I see that there's questions coming up, and there's a lot of activity in the different chats. Certainly, I could join those who are asking all of us, moderators and panelists, perhaps to consider not using the term social distancing, but physical distancing, isn't it? Because of the different connotations that are behind it. So I could absolutely join that movement. Let's talk about physical distance and not social distance. And as we know, it's particularly important when we're talking about informal transport as well. Vice Mayor, I see your slides are just there, are just about to be displayed. Yes. Shall I pass on the floor to you? Yeah.
Okay, I'm just trying to share with you my.
Perfect. We see it.
Yeah.
I think that if you now click on display full screen, we probably have it.
Yes, how to share.
We can actually see them, I think, well enough. Well, I don't know what Fiona feels, but I think I can see them on my screen. I can certainly understand what the slides are saying, and perhaps in the interest of time, we could get started. I don't know. What do you think, Fiona?
I think so, Mauricia. We can see very clearly your slides. We'd be happy for you to proceed with the display.
Yeah, we can see it. Please go ahead, Vice Mayor. We can see it well.
Yeah, okay. Okay, thank you very much. Of course, as I said, my name is Ernest Sabimana. I'm Vice Mayor in charge of urbanization infrastructure in the city of Kigali in Rwanda. So you're going to share a little bit experience of about urban mobility during this COVID-19 period. So what has happened in Kigali and what happened in Kigali. So of course, the country Rwanda had ordered a lockdown on March 21 to prevent the spread of COVID-19 coronavirus. So under this lockdown, people were obliged not to make unnecessary movement outside of their homes. So this means no public transport allowed from 21 March to 3rd May 2020. Of course, the city was clean, so there's no pollution, so nothing. So people used to stay at home. So, but 4th May, one has partially, of course, left code now. So public transport after this period, so has been allowed. But it means like 2 days ago, because yesterday. So yes, so if lockdown yesterday, So of course, since yesterday, the public transport is allowed. But when you look at Kigali, we have like 3 modes. So we should have like, of course, this public transport using buses, and then public transport using this motorcycle. And then of course, let's use like this bicycle model. But of course, due to topography of Kigali is like mountain city. This bicycle model, of course, is it's of course it is like sport, but of course we cannot say it is like public transport. So mainly in Kigali we have like, of course, it is public transport by bus, and then public transport by motorcycle. But of course, as I said, since yesterday, the public transport is partially allowed for buses. So this motorcycle are not allowed. Maybe we are going to see what will happen in 2 weeks. So it means now this day, of course, since yesterday, we are using buses, but it's not easy. Of course, we have to take a decision or some measures to control in line with this coronavirus lockdown. So in Kigali, you can see there is like, of course, we have to consider this social distancing, like queuing plan for major bus stop, including, of course, taxi parks. Of course, there are some measures. You can these yellow circles. This is like marking for social distancing being plan for major bus stop. And then you can see that this is like inside buses. So this inside buses, you can see there's marking for social distancing inside the bus. So this means if the bus, of course, has the capacity like these occupants, it has the capacity, of course, to carry, for example, 52. Due to this social distancing inside the bus, of course, the capacity is like the half. So this is actually affecting the number of freights in the city of Kigali. And then, of course, during the peak hours in morning and then in the evening, of course, you can see, of course, very long queue in the bus stop, and then, of course, in the taxi park. So this is how the Kigali, of course, the public, the local government. So we are talking about the local government. There's Minister for Local Government. Of course, the city of Kigali is under Minister of Local Government, but you have also the Minister of Infrastructure. But in this exercise, we are working together with Rwanda. RTDA is like transport agents, government transport agents. So this is like, of course, the joint exercise. Of course, the police is joining the team for enforcement of these measures. Of course, you can see, next slide, there is, of course, before entering, upon arrival at the interest of the taxi park. People, they have exercise, so they have to exercise washing hands. So after washing hands, of course, you have to enter in the taxi park, of course, in this major bus stop where we have like these young volunteers. So these young volunteers, they are helping our citizens in queuing before boarding to pass. So this is a very good exercise, and then is helping much in Kigali. Of course, at least to leave this 1.5 or 2 meter like social distancing. But you can see, of course, what is happening inside the bus. You can see there is marking for social distancing inside the bus. You can see like this view, and then of course, this is of course depending on the, if we have like 2 seats, of course 1 seat are allowed. So, and then the next seat is not allowed. So this, of course, the capacity of the bus, the carrying capacity of the bus, of course, is reduced to half. Of course, you can see for this next is, of course, it's like people, of course, sitting inside the bus. So you can see now we are, of course, this next, you can see, of course, there is people, they are sitting, of course, following or just ordering this social distancing inside the bus. Of course, there are some challenging, of course, as I said, especially like these peak hours in morning and the afternoon. Of course, the carrying capacity of the bus has been reduced to half. Of course, we are facing like this queuing, so long queuing in morning, and then of course in the evening. And then another challenge, of course, is like as I said, of course, previously. Most of people in Kigali, of course, they have they like using this motorcycle. And then, of course, currently, because of these measures, so motorcycle, of course, for these half, they are not being used. So we are actually waiting maybe after 2 weeks what will happen. But for the moment, of course, only transport buses are allowed. And then, of course, you can see if there is a big number, of course, they used to use like this motorcycle. Now it's shifted to use these big buses. So, of course, this is also a big challenge where, of course, we are facing in the University of Kigali, so we are trying to solve it. And then, as I said, of course, people these days, they are trying to adopt like this, let's say, like biking. So it's most of time, because of the topography of Kigali, people, they didn't actually use like these bikes. Because of this period, of course, people, they are trying to find like other solutions. So people these days, they are starting to use this bike, of course, instead of using motorcycle. And then, as I said, there is a shortage of these buses due to this social distancing inside the bus. So as I said, of course, after 40 days in the lockdown, so we resume activities, business in the city of Kigali yesterday. So we are, of course, we are still running. So we are of course, seeing what is the main challenge, and then how, of course, we should sort out these challenges. But so far, so good. I can say, of course, using like this social distancing in the buses, it's a very good exercise. And then, of course, involving these for volunteers. And then, of course, as I said, it is joint exercise where we have like a Minister of Infrastructure, and then we have like police, and then we have like a Minister of Local Government. Of course, the Department of Transport in the University of Kigali. But of course, there are some reasons we have to learn from this lockdown period. So we have to look for another, of course, mobility, bit more diversity of Kigali. Of course, we cannot, of course, depend on these buses. So we are thinking, of course, how we should design our roads. So including like, of course, like these biking ways, of course, and then, of course, how we should improve this motorcycle using like this electrical motorcycle, which is actually compliance with the air pollution, things like that. So actually, so this is the thing, of course, we have seen so far in this lockdown period in the city of Kigali. As I said, of course, we lifted this lockdown yesterday, so we are still, of course, learning some challenges. I think, of course, in a few days, we are, of course, we are just improve our mobility system in the city of Kigali.
Thank you so very much. Thanks indeed, Vice Mayor. We certainly understand, you know, how difficult it is somehow to take stock on what's been occurring when you are still in the midst of actually responding to the needs, to the urgency. But I very much appreciate how you've already projected some things that could be, you know, carried over, and what needs to happen in the future, and how you are trying to think about those different measures, whether it is on the policy level or in close collaboration with the different stakeholders. Thank you very much indeed for joining us and for carving out time. I am conscious of time, Fiona. I'm being told by Carly, you know, there's a lot of little hands and little geniuses behind the scenes to make sure that this keeps running. And there's a genius called Carly who's telling me that we still have 15 minutes left for questions and answers. So that's what I'm going to try to do here. I'm going to read perhaps the questions that Steffi from UN Habitat, another a genius hand in the back, is sending to me. She's trying to make some sense of the different vibes that we are getting. And there is a lot here indeed. So Vice Mayor, Ms. Hara, Mr. Harry, keep your ears, you know, and your brains engaged. I go there with the questions. We can read them in the chat, I believe. So the first question is asking us that, so when transport is fully restored, but with reduced capacity for vehicles, due to physical distancing, will this not increase the demand for vehicles on the roads? So how are policymakers, how are they going to deal with this? How are we going to deal, let me perhaps add a bit of my own thinking here, how are we going to deal with a return to the car, a reduced use of public transport, that stigmatization of public transport, and that temptation to go back to vehicles, whether it is the private vehicle in the vast majority of cases or not? How are we going to deal with that? There is a question as well that tells us about the change that we are experiencing in actually financing the operations. The question is a bit long, but basically it tells us that we are moving away from a mobility-based access to a bit more of proximity-based access and digitally based access. So how do we manage the financial exposure of our transport investments? Will our public transport infrastructure plans be perceived as a higher investment risk from now onwards? And a complementary question to that one is asking us a bit about costs of operations are getting increased right now due to the lower occupancy, and fares can be up. So what is the alternative in terms of revenue support for the operators? I think that both questions go hand in hand, isn't it? How do we deal with the increased risk that will be perceived by investors, and how do we try to avoid that risk is passed on to the fare, therefore to the citizen, in many occasions to the most deprived and most vulnerable and most excluded? And last but not least, I'm going to pick up a question about the reconciliation between road safety and hygiene. So the question comes from a colleague who runs a boda leasing company. So here we got informal transport services, private run informal transport services in the equation, telling us that they are discouraging the riders to use the helmets, the shared helmets that are provided when you jump on a boda. So this poses risks. So how do we reconcile this? How do we reconcile the road safety with the hygiene measures to keep the informal transport services operating and people relying on them as both safe and hygiene? And last but not least, let me just throw it in there. You might not be able to pick it up, but I think it's a very interesting observation that you have brought us a lot of examples about passenger transport, isn't it? About how do we move people, including essential workers right now. But what about freight? What about moving goods, particularly around a city? What about ensuring those supply chains that we know are as essential as ever, particularly when in certain places we know that we're all buying desperately online in order to overcome the lack of economic activity at the same intensity that we used to have before? So those have been the questions that have been put there. Any responses that any of you would like to provide? And may I ask you to stay rather brief in your responses, so perhaps we can give you equal chance to the three of you and not eat up a lot of time from the following sessions. So who would like to break the ice and pick up any of these questions and share your reflections, please?
Okay, thank you very much. So let me start, of course, with this first question regarding like the consequences, just like which is associated with reducing the number of threats. Actually in Rwanda, so apart actually from the city of Kigali, we have a Ministry of Infrastructure. As I said, of course, we have a Ministry of Local Government, and then we have like, of course, like a transport government, transport authority. And then we have like regulatory RURA. So RURA is like Rwanda Utility Regulation Authorities. So this RURA, or Rwanda Utility Regulation Authorities, actually is the which is regulating the, of course, the transport and fees of these things. So the transport actually this day is under in terms of regulation. So of course, even these transporters, so in terms of course the number of buses which should be used, the type of buses which should be used in transport in the city, all these things are under Rwanda Utility Regulation Authorities. Of course, it worries is like my voice, so, but you have to find some sort of solution, especially regarding like reducing freight. So that's the number of buses. As I said, of course, we partially with the lockdown from yesterday. So yesterday it was like the first day of experience. So as I said, the first day in the morning and evening, so we realized that of course there is some, of course, in some taxi parks, of course they are crowded. And then in the morning, of course, people from home heading to offices. So we can, we realize that of course the number of buses are not enough. So we cannot, the number of buses are not enough. The challenge, of course, the number of buses is enough, but the problem is, of course, the buses, the loading capacity. Now the bus is carrying like the half. So if the big bus, of course, is supposed to carry 65 people, now is carrying like 25 people, depending, of course, of this social distancing, which is applied inside the buses. So this is like a big concern, of course. So now the city of Kigali, and then the collaboration with the Ministry of Infrastructure, and this Rwanda Regulation Authority. So we are now just see how we should increase. We should increase the number of buses. So we as that, of course, there are some number of buses, and then now we are. This is like a decision has been taken morning. So we are going to increase the number of buses. So there is another question, of course.
Thanks very much, Vice Mayor. I am so sorry to have to interrupt you, but the organizers are telling me that we have 5 to 7 minutes left in this session. So can I ask you to wrap up very fastly, and I can pass the floor on to the other two panelists. Thanks very much, and sorry again.
Of course, for financing, so there are some worries. So we had a meeting, of course, if there is a bus operators. So, but there is something, of course, the government is doing something. So, so like since yesterday, of course, the government is using the price of fuel. And then, of course, there is there are some charge of the parking. So since yesterday, from yesterday, the government is not, of course, charging these parking fees. So it's like free. So this also, it's like encouraging these operators. So of course, hygienic, so I can understand. So in terms of this using or just bringing in this motorcycle, it's not the time, because the government, of course, is controlling the measures to stop spreading this COVID-19. So that's why, of course, changing helmet using the motorcycle, this cannot be applied in this during this period. Maybe I'm going to wait for 2 weeks or just more 2 weeks to see what the government should do. Of course, like transport for goods, of course, inside the city, we are using like these right trucks because there's one person, which is the driver. Those things are okay. So we can control this in urban mobility using this right truck.
Okay, well, thank you very much, Vice Mayor. Thanks a lot. In the interest of time, Mr. Harry, Ms. Hara, any reflections perhaps on this question about how do we sustain public transport financially and we don't pass on the fare increase to the citizens, please?
Yes, in Peru is big problem because our reality is very complex. Recently, the public transportation has been declared of public utility. But before designing the subsidy strategy for public transport, we were caught in the middle of the pandemic. This is a fact, and this is very, very difficult. Now we are working in designing with the government of a bunch of responses or measures to compensate low incomes and for the transport industry, because the occupation is at least 30% of the capacity of the bus. And also, we have to look it's dangerous to the people want to go to begin their activities with the private car, to the individual car. And also the strategy for the bicycle lines and the use of the bicycle is the key that we solve, and we hope to solve that, that risk.
Thank you very much. Thanks very much, Ms. Hara. Mr. Harry, any reflections that you would like to share, perhaps in 1 minute, 2 minutes maximum? We need you to unmute your microphone, I believe.
Yeah.
Perfect.
The first one is, as a single word, is a crowd management. Number 2 is the financing. For crowd management, from the day of opening of the lockdown, the people are going to flood to come to get the public transport. So ideally, a city will have to be geographically, or a city needs to be divided into multiple time zones. One time zone will start from early morning, the other time zone will end up in the late evening, something like that. Few time zones needs to be divided, number 1. Number 2, you need to come up with the operation hours of the bus, public transport needs to be lengthened, number 2. Number 3 is you need to increase the headways. When you have occupancy rate is less, you need to run the buses on the same route with very short frequencies. Therefore, you may require additional buses. There are, in India, we have 2 types of buses. One buses which is for the public transport, the other one is for the private use. We need to hire those private buses for the purpose of public transport, you can double the number of buses by which you should be able to meet the demand. As I told you earlier, we need to develop a demand-based system. The people will have to tell the public transport operator at what time I wanted to travel. So this, based on the data, we should be able to tackle the demand of the public transport. That's over. The second thing is financing. Financing, there is no other option. The government will have to do some kind of subsidy. There is no other way. At least 20, 30, 40% subsidy have to be done.
Thank you so very much, Mr. Harry. It's been very practical. And I think that if you allow me, Fiona, in 30 seconds, I think that we are seeing how certainly we are facing, and cities are facing directly, that reality of a stigmatized public transport, isn't it? That reality of a private-driven informal transport that is on what a lot of the citizens of many global South cities depend in order to access their livelihoods are being put at risk. And we also see that there's opportunities behind harnessing the active mobility, the walking and the cycling lessons we are learning right now, thanks to tactical mobility. I think that Mr. Harry has just given us the cue here. We are right now in the process of thinking about industry liquidity schemes and the stimulus packages, and it's obvious that those ones are going to have to be about supporting subnational governments to actually give them access to those financial means that they currently lack in order to keep a public transport running as the backbone of mobility in the cities. Those stimulus packages should also be about unleashing green investment at scale for the right type of mobility, and certainly about sending signals to the market, as I think Ms. Hara was telling us. And last but not least, a notion that came, I think, from Ms. Hara very prominently, the notion of public service. Will this crisis, as human beings, allows us to perhaps reorganize a bit the hierarchy of values and understand that there are certain public services and certain public policies that we could consider as common goods, and we could use public policy as a way to safeguard those public goods and those common goods and protect us from the common bad. So thank you very much to the three extraordinary panelists. It's been an honor for me to listen to what you have been doing in different locations of the globe. If we were in a physical event, I would just be calling for a round of applause. We are not, so I'm applauding from here. Back to you, Fiona. Thank you very much indeed.
Thank you very much. Thank you very much.
Thank you very much to Marusha for steering us through an excellent first session. And may I add, on behalf of the hosts of this meeting, thanks to the three speakers of session one. This has stimulated our thinking, and we've learned a lot of the experiences in three diverse locations, hearing about how the cities are responding, discussing now how to finance that response and going forward, and also hearing of opportunity and the ambitious and remarkable goal set in Lima to achieve 301 kilometers in 100 days. I hope we can hear about the success of that going forward. I would like to remind everyone who's joined this session that we're here this afternoon convening the Moving Together session, looking at the Global South experiences, challenges and opportunities of managing urban mobility during the COVID-19 pandemic. My name is Fiona Bull, and I'm very pleased to host on behalf of the many collaborators of this session, this afternoon, sharing of knowledge, learning, and then planning forward. It's my pleasure to remind you that this is being recorded so that you will be able to listen to those examples, comments, and questions, and that will be made available, and the organizers will communicate as soon as that becomes live and available. It is my pleasure to start the second session of this afternoon, and I'm pleased to hand the floor to Chris Cost, the African Director at the Institute for Transport and Development Policy, ITDP, well known. We have a virtual round table. 5 speakers are joining Chris, and I hand the floor over to Chris. Thank you.
Thanks, Dr. Bull, and thanks to organizers for having us here today. So I think we've seen in the initial session the kinds of strains that that COVID-19 is placing on the transport sector, and it's been particularly severe for informal transport due to the lack of safety nets. Workers are facing lower demand and you know, and a lot of challenges. And then at the same time, users are facing increasing costs. So in the next segment, we're going to hear several more perspectives on how cities and national governments are strengthening their transport systems in response to the crisis, ranging from Indonesia to the Africa region. And we're also going to start with 5 minutes of opening comments from each panelist. And then we'll open it up for discussions and some questions from everyone. So I first want to introduce Engineer Bambang Nurhadi, who's the head of Metropolitan and Big City Subdirectorate in the Indonesian Ministry of Public Works and Housing. Engineer Nurhadi has been leading the process of developing a national manual for walking and cycling infrastructure, and he's also been involved in many projects to upgrade streets in urban areas. So Engineer Nurhadi, I think we'd be curious to hear whether the ministry has been rethinking any of the design standards given the current crisis and the need for physical distancing. And it would be great to hear about other ongoing initiatives that the ministry is taking up to develop better non-motorized transport facilities. So I'll hand it over to you, Engineer, for your comments.
Thank you very much. Good night from Jakarta. I am Adrianus Bambang Nurhadi. Would like to say thank you very much for your invitation in this festival. And we would like to support in this discussion from our idea as the official of the government. Also, one regard to all of the participants here that's already joined in this discussion. Especially for the UNEP, would like to already manage this meeting. This is the special meeting. So today I would like to bring our paper in the improving city resilience in Indonesia through non-motorized transport. Okay, we would like to show you my PowerPoint. And the first, we would like to explain about the national government mobility measures on COVID-19. This is the critical in the world about the COVID-19. In Indonesia, especially Jakarta is the capital city, public transport and non-motorized transport are still the backbones of the most essential workers' mobility. As you know, Jakarta, surrounding Jakarta area, most of the workers from this area. Now our government, using the regulation from the central government, we use the large-scale social restriction based on the regulation number 21, 2020. This is looks like the lockdown in our country also, but we divide between province and another province, and sometimes also from the one or more than 3 province, we also together to join with the large-scale social restriction. And the second, as you know, Indonesia is the most of the people are Muslim. Sorry, I have to inform this because we have a special and unique way in the world. We have the upcoming annual homecoming. This is look like the annual activity from the people from the big cities in the Idul Fitri holiday. They would like to back home. They would like to go to hometown. Now, due to the COVID condition, our Ministry of Transportation already issued the regulation to ban from the mobility of the people. So now we can say no occasion to back home. It means when the people stay in Jakarta, so no occasion to back in their hometown. This is also difficult condition, but we have to do to reduce the potential influence of the COVID-19. Then we are going to the what is the new normal in transportation and infrastructure. Let's see in the next picture. Yeah, we have the normal transportation system, any non-motorized bicycle, and then also motorized transportation, and also the public. Now we also already grow with the public transport using the railway. This is very good in our country as the development of the public transport. So then we would like to how to maintaining the health of public transport user. As also some of the speaker also talk about the public transport. Now, due to the regulation from the central government, now most of people, when they are going to use the public transport, so any checking of the temperature, and also have to bring themselves of the hand sanitizer, and also prepare in our terminal, in our bus stop, prepare of the hand wash basin. So people have to clean, and also have to use also the mask, and the people should be bring the mask every day when they go out from the home. This is also very restricted. It means if no important of the activity, government also do not outside of the home. It means stay at home. And then in the public transport, we also use the physical distancing in the bus and also in the station. How to queue, how to come in the bus transport. And also for the terminal, for the bus, we also always make clean using the disinfectant periodically, buying the special task from the local government. Let's say in Jakarta, buying the Jakarta province, they have a special task due to make the clean of the some infrastructure due to the public transport accessories. Next.
Engineer Baba, we're just about out of time, so can you take a few more seconds to wrap up, and then we'll save some time for the other speakers. Thanks.
Okay. Okay, and the next, we also got the lesson learned on non-motorized transport experience from the past crisis. Let's say in the 1918, we get the big disaster in Lombok. Now, starting this condition, some of the activity using the bicycle. It means we use the NMT in the police patrol and also some of the public. Also, some of the ministry create of the activity to make the common of the using of the bike in the circumstance of their city. This is some of the small city also already using the bike as the for the supporting of the activity. Next. And then number 4, we would like to explain about the initiative during the COVID-19 pandemic. This is very nice practice in our country. Some of the city prepare the distance between the seller and the shopper in the traditional market. So most of the traditional market already use this application. So we keep the activity in the social distance and also physical distance. In the picture, this is one of the example in the central city of Salatiga. Next. So what is the main principle of the NMT infrastructure? As you know, that we would like to prepare on the non-motorized transportation, so we have to think about the complete. It means continuous walking and cycling facilities, available of the crossing, access to basic facilities, public space, business space, and transit facilities. And also multi-function land use. This is very important. Another point about the comfortable, we have to keep the shading of this area and then active frontage of permeable buildings, small blocks, seating, trash bin, placemaking. Next, about the safe condition, regulation, motorized vehicle speed, safe crossing and intersection, provision of lighting, placement of physical buffer. And last, about the inclusive, we talk about the universal standard, tactile paving, wayfindings, signage, ramp, this is for the disabled, and the others, we talk about the support of public transport. This is the integration system to the public transit transportation. Next, application in Indonesia. As you know, now we get quite a lot of growing in Jakarta especially and also another city. System integration in the sidewalks. Let you see about the condition on the sidewalk and then integration with the bus stop. This is in the Jakarta area. But in the right end, we also still some cities not fulfill this condition. So I'm sorry. So we compare of this condition, the best condition and the worst condition also.
Great. So Engineer Bampang, I'm really sorry to interrupt, but in the interest of time, I want to open it up and go back to our other speakers. So thanks very much for that introduction, and it's really inspiring to see the repurposing of market space that you showed, of how we can convert the street space and make sure that we can follow the physical distancing. Yeah, thanks.
Yes, okay, thank you very much.
Thank you very much. So I'd like to next move, if we have her on the line, to Ms. Abimbola Akinajo. She's the newly appointed Managing Director of the Lagos Metropolitan Area Transport Authority, or LAMATA, in Nigeria. She has a background in civil engineering, and she's the first woman to lead the agency in its 16-year history. So we've seen that LAMATA, was one of the agencies that implemented early measures to encourage physical distancing in the BRT Light corridor. And it'd be great if you could share your perspective on how well those measures have worked, and perhaps also address how the state government's been regulating the operations of the informal Danfo minibuses. So Ms. Akinajo, I'll turn it over to you for your remarks.
Okay, thank you very much, and good afternoon, good morning, good evening to everybody. It's great to be here, and it's been very interesting sessions that I've listened to so far. So, LAMATA, Lagos, mass transportation, people movement, a big problem for Lagos because we're a city of 21 million people, and we just have to move ourselves in the small space that we have. So what is it that we've been doing? The way that we've been working, we've been encouraging physical distancing on our buses. And like Chris said, we worked with our operators to ensure that physical distancing is made prominent on the buses that we run. So the operators have to mark their buses and indicate where you can sit and where you can't sit. We ensure that you're not sitting next to anybody on a bus and you're not sitting directly behind anybody else either. So we sort of have a zigzag position that allows people to at least practice some form of safe physical distancing. So that's what LAMATA has been doing. We do the same with our people when they are trying to board the buses. There's all the usual things that everybody's talked about, ensuring that your people are sanitizing their hands as they get onto the buses, ensuring that your buses are disinfected at the start of a journey and at the end of a journey. We liaise with the Ministry of Environment to help the operators to carry those activities out. With regard to our informal sector, we have done a number of publications, a number of meetings with the unions, and what we've done with them is that we've given them guidelines. That was handled by the Lagos State Ministry of Transport. We spoke with the union leaders. We have got leaflets that we have put out. We actually have a whistleblowing line that allows the passengers as well as the operators to phone in and tell us, oh, this particular bus operator is not complying. That way we are allowing our people to watch out for one another. At the end of the day, COVID-19 is something that we're all in together, and we all need to ensure that we're safe. Be your brother's keeper, but also be your own keeper. Ensure that you are following the guidelines. So for instance, in Lagos, we have guidelines for all forms of transport, public transportation. And we have leaflets that we hand out to everybody that comes onto our terminals, our buses. Those leaflets are very clear as to what you should be doing and what you should not be doing, where you should be sitting on a bus and where you should not be sitting. Everybody now knows that you're not supposed to be really sitting next to somebody else. On the downfalls, these are our little minibuses. They carry, on a normal day, anything from 14 to 18 passengers. So the 18 passenger cars can now only carry about 8 passengers, and you make sure that it's a long bench. You're not, there's like 2 spaces between you and the next person. Those are the sort of things that Lagos State has put in place. And for now, if you will remember, Lagos was on lockdown from the 24th of March to the 4th of March. So we came back from lockdown yesterday. And I'm sure you can imagine everybody came out. And that was a challenge. And in doing that, but before they came out, we had done all of these press briefings. We had done all of these meetings with the unions. So the operators, even the informal, knew what they were supposed to do. The challenge was ensuring that the people would comply, because everybody, like we all know, patience is not something that is well known when you are trying to get somewhere. But we ensured that we had people out there who sort of helped passengers understand the reason why they needed to be doing what we have asked them to do. And interestingly, yesterday was chaotic. We must, yesterday was hugely chaotic. People sort of were a bit anxious and all that, but today has been a lot better. Today is day 2 of public transportation and day 2 of people understanding that we are sticking to our guns just to ensure that people are safe. We're ensuring that physical distancing is maintained. We're ensuring that you're washing your hands. We're ensuring that you are sanitizing. We're ensuring that you're wearing your mask as you get onto our public transport. And I think the thing with people is, the more you make them realize that you're not going to stop because this is for their own good, they're starting to work with us. And I think that is the most that we can ask. We need to ensure that people understand why we're asking them to do what we're asking them to do. And for day 2, encouraging, I would say. Day 1, a bit chaotic. Day 2, encouraging. And I'm hoping that following on from day 3, day 4, day 5, it will be even better. So from Lagos, I would say that we're trying to manage the situation. It's challenging. It's a challenging time for the whole world, but we all just have to do everything we need to do to keep our people safe. And that's what Lamata is doing. Thank you very much.
Great. Thanks very much for those remarks and for keeping the time. And it's great to hear that the new measures are starting to work now that the city is coming out of the lockdown. So from that perspective, from the agency side, we're going to turn to the public transport workforce. Our next panelist is Joseph Nderitu, who's the chairman of the Public Transport Operators Union in Nairobi, Kenya. He's a matatu driver, and he's been a leading advocate for improved working conditions for the public transport workforce in Kenya. And just by way of background, Nairobi and other Kenyan cities have had an evening curfew, and public transport services have continued to operate with occupancy restrictions during the day, and also a new requirement that operators and passengers wear masks. And the government's also encouraged the use of cashless payment. So for Mr. Nderitu, it'd be great to hear your perspective on what extent these measures have been succeeding. What are the challenges that operators are facing? And how do you think government can play a larger role in addressing some of the issues that transport workers are facing? I'll turn it over to you. And just be sure to unmute. Hi, Joe, can you hear us? Yes, now it looks like you're on. So go ahead with your feedback.
I hear you. You can hear me?
Yes, yes, please go ahead.
Okay. Thank you very much. Hello, everyone. Is at public transport workers in Nairobi, Kenya are facing. That is long hours of working. There's a police and
Hi, Joseph, we're having some trouble with your connection. So I think what we'll do is we'll go to our next presenter, and then we'll come back to you once we can work out the connection a bit better. So maybe, okay, yeah.
We have violence, sexual harassment for the women.
Yeah, great. So let's, while we're working on Joseph's connection, let me introduce Amanda Gibbard, who's the Director of Universal Design and Universal Access in Public Transport in South Africa's Department of Transport. She's been at the forefront of, yes, hello. Hi. Yeah, so I mean, we understand that South Africa, most of the public transports in the form of 14-seat minibus taxis, which present a lot of challenges in terms of physical distancing. And now with the recent easing of the lockdown, the services resumed with some restrictions like the 70% occupancy cap. So it'd be great to hear your thoughts on how the informal transport sector is coping with the pandemic, and also how the response in the informal sector compares to the formal modes, like the bus, BRT, and rail systems in the country. And we've been getting a lot of questions about universal access and how persons with disabilities are being considered or not in the response to COVID-19. So I'll hand it over to you to address those issues.
Okay, thank you very much, Chris. I hope I've sort of prepared answers to the questions that you sent, which I hope, having looked at some of the other questions that have come in, I'll be able to answer. So, I mean, really, I think I'd like to say, to start off with, that South Africa recognized that COVID-19 was a transport issue from the beginning. The national lockdown came as local transmission started on the 26th of March. And this was shortly after international transmission had taken place with travelers from China, Europe, and the US, as well as the Middle East in early March. And this wasn't unusual. I think a lot of other African countries followed the same process. I mean, basically, it was a reaction to, just wanting to do something to protect people, and also realizing that, maybe the health system wasn't the best it could be. And in doing so, we gave ourselves a window to sort of start organizing things in a different way, and to get to be a bit more prepared. So our lockdown was quite dramatic, and basically most people had to stay at home, and that included people with disabilities. And then what happened was it was through a state of disaster. So we put in a risk-adjusted approach to the state of disaster, and that included transport. So we still don't have international transport or travel, except for repatriations and the movement of goods between borders, obviously to keep the economy going and keep people being fed. But all forms of transport are very severely affected. We've also stopped transport between the 9 provinces. So basically we were trying to stop the spread of COVID-19 to really remote rural areas, and to protect people. So what's happening now is we're in another period of transition as we come out of lockdown. We've got 5 levels. We were in level 5, we're now in level 4. So there's some movement between provinces, So we're in that period, it'll go on till the 7th of May. And what we've done is we've got this risk adjusted approach because we've got to balance the viral spread with the health system and the economic and social risks. So what we're seeing at the moment is a change between people in different city centres, and that might change the overall number of cases in different provinces. So nationally, the rate stands at 0.02%, and the death rate of infected cases is 1.9, and that might change in different provinces depending on what happens during this 7-day period. So basically what we're doing is we're trying to support public transport, whether it's public or private, informal or formal. We have a national curfew, which is between 8 p.m. and 5 p.m. And local commuter transport for essential workers and essential services will now run between those times with a grace period of an hour. We've reduced operating capacity, but as you've already said, between 50 and 70%. That depends on the mode of transport. But basically, those are directions that have been published, so they will be enforced. And we also have brought in screening of all customers who use a service, so that includes public transport. So that what we're trying to do is to make sure that people don't use transport when they are ill, and that they can then recover before they start using it. So some of the other measures we're doing are not transport related, but they do affect the demand for transport. So we're encouraging people to work from home, and those are especially people with underlying conditions affecting their respiratory or circulation systems, and those above 60. So it's changing the way we view chronic health and disability. Everyone must wear a cloth mask on public transport, and along with all the hand washing and social distance measures. But what we're doing is we're making funding available to these systems. Some of those include minibus taxis and some of them don't. So we've got sort of more organized integrated public transport systems. But there's a sort of an integration measure really with the informal sector and the formal through these integrated public transport networks, and that's sort of unpacking as we go along. But we are working with both sectors, and both are included in this. I think as far as people with disabilities are concerned, we're looking at this in a slightly different way now, and we're in stage 4. That's different to stage 5, where everybody had to stay at home. That was a problem for people with learning disabilities, and one of the things that we've done is we've got through social media, we've got organizations of government officials set up so that we can try and sort problems out locally when we come across them. So we're doing that, and we're also looking at packages that need to be made available to people with disabilities. So this issue of people who are blind having to touch handrails more. Just because you are blind doesn't mean to say you won't be able to use public transport anymore as the lockdown is lifted. And so we need to look at those measures, and that is something that we're thinking of. I think, in the long run, we know that universal design allows for more independent movement, and it's going to provide for the introduction of shorter walking distances. We have all those standards. We have an equality clause in the Constitution. And I think the history of the country makes that quite difficult to have dealt with before this happened. And I think it's going to put an extra focus on that. We do have provision for reasonable accommodation measures to be made on public transport as any other service. Those were in the initial regulations, and that's in a way what government officials are dealing with on a sort of case-by-case basis. So those are the sorts of measures that we've introduced. I think, in summary, I think that this really is making us look at urban city development as an economic model. That's what we need to start dealing with. It's how cities work as an economy, and transport is part of that. I mean, obviously we want to encourage walking and cycling, but that's difficult with the sort of distances we've got between township and town, and there's no short-term measure of dealing with those. I think the other thing it highlights is the importance of IT, because one of the ways that we have and are continuing to look at is we've had people working from home, and in a way that stops people having to move unless they want to, and in another way it opens up more options for choice, so that when you do move, you move because you want to and not because you have to. So the other part of the informal issue, as well as the informal transport, and we've been working very closely with the informal transport sector to make sure that they're brought in and they're covered and their needs and issues are covered, so that people who use those forms of transport are protected. But obviously there's the informal settlement issue too here, as in many other African countries. And there's an issue of lack of access to water or poor sanitation, and people with disabilities and elderly people are included in those. So we've got a department that's working on that. But again, the issue that is highlighted is that you can't sort the transport problem out without sorting out the settlement issue as well. And I think if there's any research that's been done in that area, I'd be as interested as anyone else to hear about it. Thank you.
Great. Thanks so much for those remarks. And I think it's a very good point that we can't look at the mobility issues in isolation, and that the way that we're planning our cities is exacerbating some of the travel difficulties that people are facing during the pandemic. So that's certainly something that needs to be addressed moving forward. So moving on, I'd like to invite Dr. Mandon Gabriano to give her remarks. She's urban and regional planner and lecturer at Makerere University in Kampala, Uganda. She's been involved in a number of urban mobility projects, including the ongoing transformation of Luam and Namirembe roads in the Kampala city center, where there are great new walking and cycling facilities being implemented. And we've seen that in Uganda, there have been a lot of very interesting statements, including from the president, extolling the virtues of cycling as a healthy means of transport during the pandemic. And so it'd be great to hear your thoughts on how Kampala can build on that growing interest in cycling and some of the factors that the national government should consider in the response moving forward. So over to you.
Hi, Chris. Thank you. Hi, everyone. I think this came in as a blessing to our side, especially when it comes to active mobility. But generally, private car transportation was banned, except for the essential workers. Public transport, which is majorly banned, that is the border for commercial purposes. They can only ferry cargo or food, but not people for the social distancing aspect. So it's quite similar with what we've had also from Peru, what is happening all over the world. But for active mobility, it's something very huge for this nation, probably for this continent, because cycling has gotten the topmost voice of a nation to the public, that cycling is the safest, is the healthiest. Yesterday, our president said that in respect to, last night rather, in respect to social distancing or physical distancing. And this is something that I think most countries lack. Uganda is also lucky to have had a non-motorized transport policy in existence already. And this policy is quite emphatic that cycling lanes should be availed for all new urban roads, walkways should be available. So in essence, Uganda was a little bit ready for even more than COVID-19 because the policy is in place. Uganda had also started on implementation of a pilot project along Namirembe Road, as Chris has said. But again, the most difficult part is that the image of cycling was not always good. The infrastructure has always been very bad. And so people who were driving, who are using public transport, who are using borders, got a shock that they either have to walk or they have to cycle. And the aspect of distances came in, experience came in, and of course, the availability and quality of bicycles came in. Kampala is a beautiful city with beautiful hills and valleys, but the issue is that the network was not really existent. It's not there, it was not mapped. So we found that people during this time who used to drive are choosing routes that quite hilly because they used to drive their cars and then they think they can move with their bicycles on those hills. So I cannot say that they cannot ride in the city, but the network was actually exposed that it was not existent. Bicycle prices went up, they doubled. A bicycle which could cost $100 went to $200 US. So in fact, the bicycle business is booming. So I'm very excited as the Vice President of Wild Cycling Alliance for the African continent. But then on the other issue, the gender aspect pops up, that the women and the girls who did not know how to ride from the urban perspective, what happens to them? They have mobility needs, but they cannot ride. So this exposed a little bit of the stereotypes, the issues that we have to address in terms of culture, attitude, and mindset change, that cycling is a mode of transport. And this is the biggest benefit from this COVID-19 for us in terms of mobility, that the topmost person of the nation has said this mode is okay. So already in terms of mindset change, this message will, I think, address the gender issues that will come up or that we have seen are coming up. The issue of distances, some of the employers have decided to check in their employees into hotels next to their workplaces. This communicates something about land use and compact land use development or densification. And this is something that we haven't given time or thought. We knew it already theoretically, but we did not do it. And then we are exposed that people cannot move given the long distances. Probably in the rural perspective, it's even worse. If one has to go to the hospital and then you cannot drive there, you have no car probably. I think for cycling, this is the time that we really had to shine if we had paid attention to all that that was in place, the policies and everything. But what I think we can learn from this situation is that now that we have so many bicycle riders in our city, in our country, municipalities or Greater Kampala can start sealing off potholes, because I see that bicycle riders are being pushed to the edges, the shoulders, and the condition of the road along the edges is not really good. So being practical going forward during this time, it's important that government considers expenditure or investment in sealing those potholes so that it's quite smooth, or else our cyclists will fall off or will be knocked down. Also on street parking, these facilities could be converted into cycle lanes. There are no cars being allowed to move. So in the meantime, we could convert that space for on-street parking to go to the cycling lanes or walkways. And there can also be a temporary network mapped. This is very possible. Like I said, Kampala is hilly, but where there are hills, there are also valleys. So we have our own nice valleys, which could form good networks or routes for people to be able to ride. Also, we have realized that people can work at home. This means that the travel demand, Amanda, my namesake, already mentioned it, that people don't have to move all the time to wherever they want to go. Some things we can do from home. And also we realize that the cycling image is definitely going to improve. It will not be the same again. It's not going to be about poverty. It will be just a mode, and a mode requires planning. And that's it. As I conclude, I see that there will be a big opportunity for park and ride, Chris, and the rest of the panelists. Park and ride facilities, because of the distances we have in Kampala, people will be able to drive their cars, I think, as we go forward, unlocking the immobility. Park your car, ride your bicycle, or walk the short distance. I see the bicycle business going to boom in the short term, and also the available squares or public places that we've been using to park our cars could be converted into probably markets that people can have enough space for social distancing. And also the resistance towards future cycling plans, I don't think it's going to be the same again. But lastly, it's nice that our president and also other heads of states are saying that walking and cycling are the best for social distancing. But it's another thing that we see cycling infrastructure, walking infrastructure improve, that we see action, that we see real action steps in our country, in our cities. that we see policymakers coming up at this.
Great. Thanks, Amanda, for your comments. And I would definitely be excited as a cyclist to see those potholes filled. So hopefully KCCA can get started with that. So Joseph, I just want to go back to you briefly to see if your connection's improved. Can you hear us again? Okay, I think we may still be missing Joseph on the line. It sounds like in the interest of time, we need to move on to the next session, getting word from the organizers. So we've heard a lot of very interesting comments. There are good questions coming in. I see a lot of them are dealing with some of the same themes that came up in the first session, especially how we can meet the operating gap for public transport, where we need relatively more service compared to the number of passengers, but we don't want to increase fares for customers. And also how to manage the expansion of private vehicles and the growing amount of car use that's there. So I think that the participants have given us a lot of good pointers on how we can take those points in the future and ensure that we start adopting solutions now that will not only serve us during this period, but also provide long-term solutions that ensure that we have robust public transport systems. So thanks very much to all the panelists for your comments and suggestions, and I'll turn it back to Dr. Bull to continue the rest of the program.
Thank you very much, Chris, for taking us through the session 2. And can I extend our thanks from the organisers to the speakers and thank them for their insights and offer our apology to Joseph. The connection hasn't worked out for you to join us. We hope you'll stay and listen. Thank you to all the participants who are sending these questions in, and I'll remind you that we will get answers to those in the report that comes through. And as Chris mentioned, there's a sort of building and common areas of the questioning. So thank you very much for participating via the Q&A. We are tracking that. And thank you, Chris, for just closing down that session to allow session 3 to have their time. And it's my great pleasure to turn to an open session 3, where we hear now from some of the networks and institutions that are working in the area of promoting walking, cycling, sustainable transport. And it's a great pleasure to invite the moderator, Armin Wagner from TUMI, to take over for the chairing this session and keep his eye on the time as we go through to 20 past the hour. And I look forward to hearing how partnerships and networks can be leveraged as we respond now and look to the future. Thank you, Armin. I hand the floor to you.
Thank you very much, Fiona. Thank you very much for the introduction, and thanks to UN Habitat and all the other organizers for organizing this session, which comes at a very important point of time. I mean, what we are observing now is that in many phases, and it was very well described by many of our speakers, it was very well described how we are now getting out partially of this crisis. So lockdowns are ending and we are now entering a new phase of development in this crisis, and we really need to come together and to develop joint efforts to develop good ideas on how we can use this crisis as an opportunity to shape sustainable mobility for the future, because we need to be aware the decisions taken today will shape the future of mobility in many years and decades to come. So I'm very happy to have 3 high-level speakers with me here at this session. The first speaker is Dionisio Gonzalez from UITP. The second one is Prawn Thornton from Walk 21. And the third one is Edwin's, and the second name is a challenge for me, I need to admit, Mukabanabe, from joining us from Kenya. And without further ado, I would appreciate if Dionisio would start to give his short presentation on the question on partnerships. And UITP, as a partnership of public transport providers, plays a very important role in order to somehow change the picture that public transport gonna be the loser of this debate. So I think we need public transport to make our cities great again, to say so. So please, Dionyso, go ahead.
Thank you very much, Armin, and thank you very much to all the organizers of this conference to invite UITP. Just to let you know, UITP is a global association of sustainable urban mobility with 2,000 members in 100 countries all around the world. And as you were saying, this pandemic is giving us a very good opportunity to work in partnerships. We have and we are still, of course, learning a lot from our members in Asia, in Hong Kong, in Japan, in China, in South Korea, in many places that have already passed the stages we are facing now in this sanitary crisis, helping our members in Europe, and also starting the discussions and the planning of this management, the management of this crisis in Latin America and in many other places like in Africa. So the main focus for us in the middle of this storm, where demand has decreased tremendously up to 90% in many places, is the key role that public transport has played as an essential service. And most public transport operators and public transport authorities all around the world have maintained their services with different objectives, with the objectives to prevent, of course, any disruption into the services, to limit the risk of contamination on the job, to provide adequate support and service to the regions and to the cities, and to limit also the pandemic into the continuity of the business. So some general measures that have been considered is personal protection and cleaning, reducing contact, adapting level of services, even when demand in many places drop by 85–90%. In most of them, 60–70% of the supply was still running. A very important part of this management of crisis has been around communication, internal and external communication, and of course, a very good contact and liaison with authorities and other relevant stakeholders. So amongst the topics that we can consider and we are now discussing is what's the current status of this health crisis in the different parts of the world. So there are some emergency measures that have been taken mainly in the fields of health, but there are many impacts in the short, medium, and long term for the sector and for the society in general. So we have to deal with we have to approach different ways of working with our staff in terms of availability instead of motivation. They are heroes, kind of moving heroes, no? So this is quite important, and we have developed a campaign on this. And of course, we have to work with users, because many political messages are not, to say it nice, are not conveying the proper messages to the population. So public transport is kind of stigmatized at this point, and we should work on this. Yeah, it's very important to work with these competent authorities in the way these mobility restrictions will be relaxed, what activities will be allowed, what will be the, let's say, essential trips. Of course, there is a lot of margin of maneuver regarding travel demand management, and regarding the capacity of our transport systems and all the existing alternatives, meaning public transport again, of course, walking and cycling, because it's not only a question of saying that we can just run our services up to 30% of their capacity. We should be creative and develop specific networks, specific priority schemes for buses, etc. And of course, in close collaboration with all the sanitary and health measures. And I have taken this expression of the 3 T's from a panel this morning, where the World Health Organization was speaking about testing, tracing, and treatment. Yeah, which are the key elements for these aspects. Of course, we are promoting the use of masks or any type of facial cover for nose and mouth as an alternative to social distancing. There are other measures that are being promoted and presented by politicians and by other groups, like temperature or apps to trace people, etc. We should really be a bit, I would say, practical and determine to what extent those measures are available and then applicable. Yeah? So finally, I think that this process will be a long process. You were talking before about the day after lockdown. In places like in Shenzhen, this process is quite slow. And I think this is the good thing, the good way to approach to avoid any second wave of infections. Just to finish, in order to build back better, I think it's super relevant to have good communications and trust into public transport services. This is one of the key messages we are conveying everywhere. To have clear rules and enforcement by the competent authorities, to consult with public transport experts in many countries. All the legislation, all the rules that are being in place are defined at the ministerial level without involving the ones who are really running the services at urban and metropolitan level. Of course, there is a very important message regarding demand management, and we all should also work to flatten this curve. As I said, priority to public transport and more urban space for walking and cycling. This is a very good opportunity to recover the city for the people. And of course, a very good opportunity also to develop a stable institutional and funding frameworks in many cities. I have some references here, but I just would like to pass on to the next colleague. Any question? My colleague Yusuf Sisse, Secretary General of UITP in Africa, or myself are at your service. Thank you.
Thank you very much. This was a very helpful presentation to understand the situation of the public transport industry. Just one follow-up question, as we are talking about partnerships. Can you give us 1-2 examples how you as UITP are supporting your partners? How are you collaborating with your members, your stakeholders in this situation?
Yeah, thank you, Armin. Yes, indeed. As I said, we started all this collecting a lot of information from our members in Asia. So everything that has to do with adaptation of services, with cleaning and disinfection of vehicles, stations, etc. We are gathering all our members in different working groups and preparing some very practical recommendations and very let's say dynamic consultation between members to select and to understand what are the main and the best solutions they are applying everywhere in the world. Thank you.
Perfect. Thank you very much. So as a second speaker, we have Bronwyn with us from Walk 21. And I would say, please go ahead and tell us how you, in the field of walking, how you are supporting your members in this very challenging situation.
Thanks, Armin, and hello to everybody. It is a very challenging situation, and it's been very heartwarming to see that walking has become such a focus on the international stage, both within the transport profession and with the health profession. We know the value walking brings, but we are seeing people who haven't traditionally walked in their communities discovering that value. And it seems quite extraordinary that our oldest form of mobility is our new normal. And so what is old is new again. And there's been a lot of talk in the global north around walking for health each day, being allowed out, accessing local communities. And now how do we carve a pathway out of this recovery by widening sidewalks and enabling people to access their local services on foot and to maintain these cycling and walking levels. But what we've seen in the global south is that people didn't have that space in the first place, so they didn't even have it to widen. So we need to actually the undervaluing of walking in those spaces has to be addressed as part of addressing the challenges of COVID-19. And we need to look at actually in carving that space from the space between buildings in our cities. And we see some great examples of that around food markets, localizing food services, and localizing activities and reducing traffic so people can use the road space. But it's not just about providing space. And as we move forward in this direction, we have to make sure that these spaces are safe, that we manage traffic demand, and that we ensure that crossings and access to these areas are attractive. And that means that we have to value walking. And this is where one of the partnerships with public transport becomes really critical, because whilst public transport at the moment is suffering, as Dion said, an identity crisis, or is seen as a challenge for people to feel comfortable, walking can support that network. If we continue to invest in walking and public transport in our communities, then we can decongest our public transport systems and maintain people's access to those networks. And we can use public transport networks that are formalized. In the Global South, they're more informal, and help people to actually understand what's possible for walking. So we can give people confidence to walk by mapping those walking networks, encouraging them to understand how close things actually can be, and removing some of those short journeys. Because very often people think walking, it's too slow, it takes too long, we need to travel too far. And many journeys are further, but many journeys are short and local journeys. And if we can enable those journeys by walking, then we can, in a partnership with public transport promotion, we can promote walking for those short journeys. Then we can work together to maintain the opportunities presented by COVID going forwards. So some of the key factors are to localize services, to prioritize access to things like schools, shops, and health services for people by walking. So if you're looking for where to carve out space or where to widen sidewalks, to identify those priority accesses, services, to identify where it's possible and reasonable to ask people to walk and make it much nicer so that they will have a confidence and understanding to do so, and to maintain this viability of public transport by building on that partnership, and to reward the people who've discovered walking during this pandemic, but to also recognize that the vast majority of mode share in many Global South cities are already walking, and we should recognize that and retain those people walking through infrastructure changes, and to support that potential as we go down this pathway to recovery. One more thing, yes, about valuing our networks is that we're working with our advocacy and walking groups globally to promote, to ask for this walking in their local communities. So national governments are enabling with investment priorities and are enabling action with local bylaws, but local communities also have to put that pressure upwards and ask for that space and that opportunity. And we're supporting doing that work across our network as well.
Thank you very much, Bronwyn, for also tackling the partnership question. One specific or one follow-up question. Could you give us two examples, prime examples, where walking has really made a huge step forward in the past 2-3 months? I mean, we are aware of a number of solutions, but maybe you could give us 1-2 examples where you would say, yes, that's a huge step forward.
For walking generally?
For walking, yes.
I think it's just the opportunity that people have discovered about working from home. Again, this is a bit global north in terms of global south. Again, the access to jobs and services is very different, but discovering that services can be localized and that people can access their communities in these local services. So in South Africa, they've allowed informal food markets to reduce the distance people have to travel to reach shops. And so therefore people could choose to walk to those local shops when necessary. So it's that recognition in the global north, it's a recognition that working from home increases local journeys by walking and cycling, and that if people are going to walk from home, then they're going to want to step out into their local communities as part of that day. And it's not just the commuter journey that we're providing for. And in the global south, if we can localize services and enable access to those, and especially for schools, that would be fantastic.
Perfect. Thank you very much. So in the interest of time, our next speaker is Edwin. You are representing the Kenyan National Federation for Public Transport. I want to put it right, that's why I looked again. So it would be great if you could give us your perspectives on the role of public transport in this crisis and how you are working in partnership with other actors in Kenya in order to solve the situation.
Thank you very much for having me on this show. I also would like to thank UN Habitat for organizing this. I would also like to thank my colleagues, Dionisio and Yusuf Cizé on the program from UATP. I happen to be the Vice President of UATP in East Africa. Our public transport in Kenya has continued to be a challenge because we are largely informal. We are largely paratransit systems. And therefore, dealing with our kind of transport is a bit very, very complicated. However, what happened is that the government came up strongly to have a discussion with the Federation to try and find out how can we partner to ensure that we deal with this problem. And of course, the first thing that happened was to deal with the issue of social distancing, which meant that our bus stops are usually very full.
Oh, sorry, I think Edwin's lost. Just wait for a couple of seconds. Connectivity seems to be poor.
We had the ferry down in Mombasa having very, very overloaded. And this is an issue probably we haven't looked at. These ferry services became a big challenge. And right now, what has happened is that now there is very good order in terms of getting people onto the ferry as they cross. This marine transport also
Edwin, just a second. We have difficulties hearing you. There are some interruptions.
There was some interruption.
Yeah.
I think I was using the phone because I couldn't log on using my computer. So I had a problem and there are some interruptions on the phone. Sorry about that. So we have a problem on freight transport where we have at the border points, one country has got the systems like in Uganda. Our colleague in Uganda has talked about it, and Kenya they felt probably were a little more relaxed than the Uganda side, and that has had a problem. So these are issues that probably I wanted to bring in just to understand the problem. Now in Kenya, there were issues that came out of public transport as in urban areas, public transport as in suburban and rural areas, and public transport insofar as intercity is concerned. All these have brought about a lot of challenges. Whereas in the urban, we have had a bit of control because of the government coming in strongly saying the social distancing, you have to sanitize your vehicles. Every vehicle must carry a sanitizer and people must wash their hands before they get into the vehicles. The people who are operating in the rural area have continued to do the thing almost the same way they have done because of enforcement. The people on suburban had a challenge because when we had a lockdown, they were locked out. They can't get into Nairobi, the CBD, to bring in passengers. That brought a challenge. And then on the intercity, because certain cities in Nairobi, in Kenya were locked down, or there were partial lockdowns. And that meant that there is there's no complete entering into Nairobi or other towns like Mombasa. All this brought a lot of challenges. Now, I wanted to talk a little bit about the networks and the partnerships that we developed out of this. One of the good things that happened is that through NAMATA is the equivalent of LAMATA, the Nairobi Metropolitan Transport Authority now has come out strongly to try and have a coordination effect within the city of Nairobi. And that way we are working with them to see how they can supply sanitizers, how they can supply face masks so that we continue offering safety. There is another area that my colleague or perhaps Joseph should have talked about, and this is the issue of the workers. a lot of us have not taken care of the workers in the depots or where they sign on. How do they protect themselves? The first thing we did, we had a discussion with the Ministry of Health. And one of the things we told them that we were a lot more concerned about our workers, because these workers continue every day to meet these people who could be carrying the COVID-19. And our interest was, how do they get treated? So the first thing was, they brought out schedules and protocols that were meant to ensure that what we do in the depots, for example, we have to take temperatures of all workers who are coming on duty. We have to ensure that they wash their hands before they come on duty. We have to ensure that we sanitize the vehicles. And in some occasions, the county government has actually agreed to sanitize some of the vehicles. And in some cases, the county government has gone around the informal settlements to try and sanitize those areas. So these are some of the areas that we have. But then the other partnerships have been in terms of running the vehicles themselves. For example, you will have half the passengers you're used to carry. That means insurance is half. So we have talked to insurance companies, they've agreed. We are now in discussion with the financial institutions to see if they can reduce the cost of financing, reschedule or defer some form of payment so that we are able to pay these loans. We have had discussions, even today afternoon, we were having discussions with the Revenue Authority, who are agents of the county government, to collection of levies, to ensure that we have some waivers for at least 2 to 3 months to ensure that this is happening. Now, we have the issue of our workers who are staying at home, because it has been a challenge, because in some cases, some operators have had to, a lot of buses in Kenya or public service vehicles are owned individually under a cooperative or under a company, a franchising company. That means you have to schedule vehicles so that maybe if you have 100 vehicles, you have 25 first week, 25 the following week, another 25 the following week, just to see how you can distribute and make sure that each and every staff is getting a bit of work so that they don't stay hungry, because a lot of these people are working and getting paid on a daily basis, and it has become difficult even if you were to apply for furlough, it becomes difficult to apply that furlough.
Thank you, Edwin. Edwin?
Yes,
sorry.
please.
I don't want to interrupt you, but time is running short a bit, and I would like to open the floor again for some questions in order to allow for end of this session. So I think you raised a very important point in your speech about the economic impact of this crisis on transport operator. And I would like to ask UITP, how does this description from Edwin's mirrors with your global observations on how public authorities are reacting on these economic challenges for public transport operators, because public transport is not running on full capacity? What is your impression?
Well, my feeling and the information we got from our members is that many authorities would like to help, but they don't know how yet. Yeah? There are many requests by different sectors, by different stakeholders dealing with the development of life in cities. So we are now discussing with some of them, and together also with some multilateral development banks, on the definition of response and recovery plans that could help authorities to develop this roadmap. They have to, yeah, because we are, we are only a part of the solution, and a very important part of the solution, but only a part of the solution. So, let's say that our main request to them is you should establish clear rules and clear measures regarding, as Mukavana was mentioning, the protection of users, the protection of staff, the way we will manage this travel demand, etc. And here is a portfolio of options to help the sector in the short, medium, and long term. But as Bronson was also mentioning, I think this is a very good opportunity for us to recover the city for people, meaning walking, cycling, and public transport. Thank you.
Thank you very much. This is a very helpful perspective. Bronwen, looking at the perspective of walking again, one of the important questions from my perspective is how to make these changes which are happening now permanent. And as we are all guessing, resources are short. What is your perspective? Maybe just 1-2 short perspectives on it.
When you say the changes, do you mean the infrastructure changes?
The infrastructure changes and also the behavioral changes.
Yeah, two good challenges. The thing with the changes is the tactical urbanism approach, which is fast. It's fine to go in quickly, but to do it as effectively as possible in that first go. So don't just put down a white line to extend the footpath, but put in some barriers. But put in some barriers that perhaps have longevity. So like not just like for example, they're using road building barriers to actually create that space for pedestrians. So perhaps if we see the opportunity to put in semi-permanent footpath widening, if we're going to take space from the road, we have to see not just the widening of the space, but the traffic management down as well. So these are non-infrastructure builds, but actually managing speeds down and painting in some crossing points to make it safer for people. So we have to reframe the public space and reframe the expectation, and then follow up with some enforcement activities, because in lots of places, particularly in the global south, there is space for sidewalks, but it's highly occupied by lots of other activities and motorized movement when people can do so.
Thank you very much. This is a very strong argument to strengthen walking even further in all of our cities. Maybe Edwin, just one last remark. What is your vision for the future of public transport in Kenyan cities? Just one sentence.
Yeah, the future of public transport in Kenyan cities looks good, because one good thing is that the government officials have understood the importance of public transport. If anything, COVID-19 has brought this. But one aspect I wanted to emphasize that is coming in very strongly is the use of notes as currency to exchange. And a lot of people have said, why sanitize your hands when you are going to give notes to a conductor or a person in paying fare? How do we move out of that? And the discussion around cashless payments is becoming a very, very strong thing. And I'm thinking this should define the future of public transport going forward.
Thank you very much. These are two very positive impressions from Kenya, that local leaders are understanding the need for public transport, and the movement towards cashless payment is going to support also public transport in the future. So thanks to all of you. And I think time is running out now, and we are going to wait for the next session.
Well, thank you very much, Armin, and to the speakers of session 3. And remarkably, we have reached the end of session 3 exactly on time. So may I thank all of the sessions for their vigilance, and the moderators for their vigilance in guiding us through this. Nonetheless, I'm sure there are many questions out there. So I invite you to still use the Q&A, because we can capture your questions and they will get answered through the report that we've mentioned will be provided. So keep the questions coming, even though that we have reached the end of the opportunity to go back to our speakers and panelists of this afternoon's session. We're into the closing run here, and I would like to reflect on what we've heard. We've heard from around the global south, from India, Peru, Rwanda, Indonesia, Nigeria, Kenya, South Africa, and Uganda, as well as some of the leading institutions and networks sharing their knowledge and experience. We've heard on the ground how cities are responding, and then started to learn the more detailed nuances of those responses and impacts in this very much unfolding situation as COVID-19 continues and is different in its impact, but we're all part of that impact. we started this with the ambition of informing and inspiring and providing insights. And I think on behalf of the group, I hope that's been provided and received, because there's been an awful lot of information shared, really very, very important examples and insights, and that is being recorded for us. We've heard about how much of the guidance and recommendations of managing and responding to COVID pandemic is being implemented in the public, in the transport sector. How operators are implementing mask wearing, physical distancing, sanitizing, providing the essential transport to keep our cities and communities moving. We've heard about the dramatic impact on public transport, the walking and cycling case studies of Uganda, Peru, Indonesia, where indeed there's almost an opportunity, as the speakers presented to this, an opportunity of doing this better, and some very practical examples coming from the last speakers about how we must ensure it's sustained. We heard how maybe the opportunity is not just in walking and cycling, one of the areas I've joined to listen to about particularly from a health perspective, but how IT may have been an opportunity, working from home more, working and changing travel needs. And just the last comment there, the cashless future. So really opportunities are turning in many areas. I was particularly interested to hear about the enforcement with the whistleblower, the importance of communications, making sure providers know and are prepared as each of those phases go through, and enforcing that without any hesitation so people know what's happening, and communicating to the people through leaflets and volunteers. I'm only capturing just a surface of what I heard and enjoyed listening and was provoked to think more deeply about. There are a couple of areas we heard less about: research, the data and tracking. At the very outset, we heard of work going on to collect, and we saw a spreadsheet. I'm sure we would want to hear more, and the report will cover more about what's happening in that data collection. It has been a rich discussion. We've kept to time. We're drawing to the close, and I'm very pleased to be able to invite Robert de Jong from UN Habitat to share his thoughts and reflections as we wind down to the close. Robert, I hand the floor to you.
Thank you, Fiona. Thank you for upgrading me to UN Habitat, but I'm still with UNEP. But that's okay, because we're all one UN, you know. Today we've organized this session together between the World Health Organization, UN Habitat, and UNEP, and it shows we can do that very well together. And thank you for your excellent leadership in this session. I'm not going to try to summarize this, because it was so rich in information that I will definitely fail. I definitely want to start with thanking the moderators, the speakers, and the participants, and also our technical hosts, Open Institute for Kenya, that have helped us set this all up. Before I want to say a few substantive comments, I want to congratulate all 500 of us, because imagine if we would have all flown somewhere to have this conference, and imagine the amount of emissions we've saved today by all sitting in front of our screen and doing this remotely. I think we're learning a lot quickly, I am. And I think this is going to stay with us for the future to come. I understand that in addition to the 500 that were here on, a lot of people also following us to YouTube. So obviously there was a great demand for a session like this. And I think this should not be the end, but rather the start. I just want to remind us, taking one step back, we are in an unprecedented global experiment from a transport point of view. Can you imagine if 1 year ago I would have proposed that we shut down 50 to 60% of our transportation and see what happens? And it's happening. And remember that the world is now experiencing very clean air. Pollutions have dropped 80% of NOx, 50% of PM 2.5. And you know what? It's because of reduced transport emissions. Doesn't that give a golden opportunity for sustainable mobility in the future? Doesn't that give us the arguments we need to promote the work that we've been doing? I think this is something we shouldn't underestimate, and the initial discussion or the presentation we had on data and research hopefully will help us record that now, because we are as I said, in a very interesting times.
So we talked, and I said I won't summarize them, about major challenges that we're facing, and we're all facing them. But I've always learned with major challenges come major opportunities. And I think it's very important that we need to start thinking from major challenges to major opportunities. And we've heard very many. On public transport, talk about more buses, frequency, innovative ways of using IT, getting more income, etc., looking at subsidies and fares. But we also talk about the demand side. Imagine if the world can start working one day from home. Congestion would be over. London wouldn't have to invest billions of dollars, a study came out, in continuing building roads for cars, because one day everybody would work one day from home, that all would be over. So let's think about those things, talk about demand side. Somebody mentioned, I think it was Jakarta, diversifying working hours so we don't have those peaks anymore and we can't have social distancing at those peaks. Obviously, everybody talked about our new normal. I think it was, I can't remember who said it, as in Bronman maybe, our new normal, which is walking and cycling. Isn't that great? Our new normal is walking and cycling. And the need for infrastructure and the need to make sure this hangs on. It doesn't go, and everybody says it will. What we didn't talk so much about, which I think is also very interesting, is this all micro-mobility, all the delivery services in the cities, the sharing schemes, but also the electrification. The number of cars have dropped tremendously. Electric cars have just continued to rise over the past 3 months. Isn't that interesting? So I think there's a lot of major challenges and there's a lot of major opportunities. Listening today, I think 2 things strike me. The first thing that strike me, are these developments and opportunities linked to one another? And are we linking them? Are we linking public transport challenges with the opportunity we now have with walking and cycling? Are these things linked? Some people mentioned it, but I think we need to go much further and much more looking at integrating solutions for sustainable mobility. That's the first question. Are we linking ourselves? The second question is, are we starting to share our solutions? Because we're all in this together and our future is very unclear. And we desperately need people that tell us how social distancing works in a bus, or how they manage to raise capacity, or how they manage to use IT in a way, or how they manage to raise resources to keep their buses going. We desperately need, I think, a sharing of solutions that work in this time. So, and for that, of course, when you start tracking, as you also said, Fiona, and I think we, as a UN, we play a major role in that. So for me, more questions than answers. And some people already said we need to do this this type of events even more and at regional level. And there were so many people who come and couldn't log in. And I got some emails. I was checking. They're saying they were complaining. They couldn't log in because it was full after 500. So I think we need to think about maybe we can have some follow-up. Maybe to finalize, to say to everybody, in addition to thank you again, we will be sharing a link with the recording, so you can review it back if you want. We'll also be sharing a summary of what was said, our summary, and we'll be sharing all the slides that were shown. So if you have a specific interest in certain slides, we'll be sharing this to you. We'll also be sharing with you in this that same email all the questions, and we'll try to answer some of them, but it's not our job to answer all of them. We'd like to get you and answering those questions, all 500 together. As I said, we need to start sharing to find the solutions that work. So Fiona, thanks again. Let's see this as a start rather than an end. I think we live in very interesting times. I think I said it 5 times now. And I think we're going to have a very nice group here now that we're going to work on to make sure we find the solutions that we need. Over to you, Fiona.
Thank you, Rob. And we are exactly at 5:30 or whichever time zone you're in, but we have reached the end. And so I'd like to extend thanks to the co-hosts here, particularly UNEP and UN Habitat, who did the bulk of the organizing. A very big thank you to Carly and to Steffi, to all colleagues who helped convene the panels and the participants. Thank you very much. Look out for the report and let's look for the follow-up to keep this conversation going. Have a very good day, a very good evening, and stay safe and stay healthy. Goodbye.
Goodbye, everybody. Thank you.
Bye.
Oh, that's nice.